Hello, everyone. Welcome to today's session. We are so glad to have you here. Before we get started, I do have a couple of housekeeping announcements. First, I'd love to tell you about some of our upcoming presentations. Next Tuesday, May 20th, we will have a presentation on Beyond the Call, Industrial Hygiene Strategies to Protect Emergency Responders with William A. Jetter, PhD, and the University of Cincinnati Education and Research Center. On Wednesday, May 21st, we are going to have a presentation on bilateral assistance from active knee exoskeletons, reduce the difficulty of occupational lifting and lowering tasks. That will be with Grace Hunt, PhD, and the Rocky Mountain Center for Occupational and Environmental Health. And on Wednesday, May 28th, we'll be joined by the California Labor Lab for a session on occupational and environmental risk among U.S. agricultural workers. And that will be with Heather Amato, PhD, MPH, and Nicholas Smith, PhD. We'll be exploring tracking antimicrobial resistance on farms and community-based participatory approaches to examine risk and protective factors for farm worker health and well-being. For more, you can visit us online at coeh@berkeley.edu/webinars. And I'll go ahead and put that link in the chat. And on behalf of education and research centers throughout the country, it is my absolute pleasure to welcome you to our Industrial Hygiene Series. This is a collaborative effort on behalf of each education and research center continuing education program and aspires to provide access to current research supported through NIOSH ERC programs. Unfortunately, approximately 92% of NIOSH was terminated, and we do need your help. These free webinars would not be possible without the support of NIOSH and NIOSH-supported education and research centers. And you can learn more about how to support occupational health and safety in the U.S. by visiting the link in the chat. And if you have a NIOSH success story, we would absolutely love to hear it. You can email it to coehce@berkeley.edu. And thank you for being here today and showing your support. We are going to continue showing up for workers and doing everything we can to help keep people safe and healthy. Today's session, the impact of line speed on worker exposure to peracetic acid in poultry and swine processing, is presented by Jenny Houlroyd, Dr. PH, CIH, from Georgia Tech and from the Northern California Education and Research Center. A few housekeeping items: you are going to be muted during the presentation. If you'd like to ask a question, you can enter it into the online Q&A, and we'll save time at the end of the presentation to address as many questions as possible. We will also have the chat open, so feel free to participate and join in on the conversation. The session is being recorded and will be made available on the Center for Occupational and Environmental Health YouTube page within 5 business days. And all participants who logged in with their registration email for the full live session today will receive an email tomorrow with a link to an evaluation form that will qualify you for a certificate of completion with 1 continuing education contact hour. Once the evaluation has been completed, you'll be able to access and print your certificate. And without further ado, I'm going to go ahead and introduce our presenter for today, Jenny Houlroyd, Dr. PH, CIH. Dr. Houlroyd earned her doctorate in public health from the University of Georgia in public health policy, a joint Master of Science in public health in epidemiology and environmental and occupational health from the Rollins School of Public Health at Emory University, and a Bachelor of Science in public health from the Richard Stockton College of New Jersey. As a certified industrial hygienist with the Georgia Tech Safety and Health Consultation Program, she assists small businesses throughout Georgia to ensure that their workplaces are free from hazards as possible and that workers are protected from potential health threats. She's had extensive experience with public speaking in both occupational and academic settings and serves as faculty for Georgia Tech OTI Education Center and the Professional Masters in Occupational Safety and Health program. Thank you so much for joining us today. We're looking forward to your presentation.
Thank you for having me, and I am going to just jump right in. But before I actually start presenting, I do want to share that I was a NIOSH grant recipient when I was in grad school. So the NIOSH training grant helped support me attending Emory when I was working on my master's degree. So sharing success stories that it leads to a long career giving back and working towards protecting workers. So thank you for everything you said about NIOSH, and it's always been very important to me. So thank you everyone for having me here today. I am actually sharing a small piece of a very large project And the larger piece of that project, the musculoskeletal disorder aspect of it, was shared earlier on this month, or maybe last month. But today I'm going to be talking to you about the impact of line speed on worker exposure to peracetic acid in both poultry and swine processing. And I am going to be presenting on both, but for this project, I served as the project team lead for sampling for peracetic acid for the swine side of things. And my colleague, Dr. Betsy Noth, she did the poultry side of things. So I will be presenting her results as well, but I want to give her credit. The larger project team for this project, Dr. Carissa Harris and Dr. Robert Harrison were the co-PIs for this project. And I've listed the other key leads on this project. And the goal of this work was to assist the FSIS officers in assessing the relationship between evisceration line speed in young chicken and swine slaughter establishments, and look at the scope, magnitude, and factors that influence worker safety and health risks for establishment employees impacted by the speed of the slaughter line. And so not only did the study team and the broader study team evaluate the impact of the evisceration line speed on work-related musculoskeletal disorders, but we also had a small portion of this that focused on respiratory symptoms. So I know I had a wonderful introduction about who I am, but I just wanted to give you a more personal introduction. You can call me Dr. H. I am a certified industrial hygienist, and I do a lot of different things. I worked at Georgia Tech since 2005. My mom knows what I do based off of if I bring her to any presentations. So if I get to go to a conference and I bring my mom along, that's what she thinks I do. So that is me presenting at the American Public Health Association conference many years ago. My boss normally hears about what I'm doing if I end up taking a picture with a politician or somebody at a presentation I have to give, and it ends up coming back to him in the news. I am there with Casey Cagle, who is a Georgia politician, and we were presenting about young worker safety and health at a conference. What my husband thinks I do, I get along really well with all the people I work with. And I hope that everyone has the privilege of working with people that they really get along with. And you can be doing air sampling in a slaughterhouse and still be smiling and laughing. So I have a picture of me and my colleague smiling and laughing at a slaughterhouse. Not any of the ones included in this study that I am sharing the results for, just for the record. What my kids think I do is teach, because to explain what an industrial hygienist really does is hard to small children, though my children are not small anymore. They are 13 and 18 now. So they do understand what I do. But what I actually do is I go out and I'm looking at exposures for workers and seeing how the relationship between the workplace and the employees and whether or not it's going to be making them potentially sick. And so I grabbed this slide and added it to this presentation because I've used this in lots of other presentations, but it just so happens I'm doing sampling for peracetic acid at another plant, also not included in this study. And there I am over a chiller in a poultry slaughterhouse. All right. So the aims of this study that we participated in, that was run through UCSF in Berkeley, were much broader. There's many aims, but the primary aims for our portion that we were looking at were to estimate the effect of the evisceration line speed on airborne antimicrobial concentrations, and then also to estimate the prevalence of respiratory symptoms. And I will speak to both of them, but I'll spend a lot much more time on aim 3. So a little bit of background about peracetic acid. The use of peracetic acid as a disinfectant has really grown in the past 10 or so years, I would say. I remember going out to poultry. So Georgia claims to be the capital of poultry in the world. So I've gone to lots of poultry plants my entire career, and every stage of the process, from the hatcheries all the way down to further processing where you're making like spicy chicken tenders to go and buy in the grocery store aisle. And previously, there was a lot of chlorine use, and then sometimes in kosher facilities, it would be mostly salt. But then when we look at the different antimicrobial intervention points, we did see a shift towards the use of peracetic acid. And I have had previous experience working with different organizations studying the impact and the use of peracetic acid. One of the biggest challenges that we have when it comes to peracetic acid is there's really limited information related to what employee exposures actually are, meaning that they're publicly available in the public published literature. And then the other element of that is it's challenging because peracetic acid does not exist in alone. It is always in equilibrium with acetic acid and hydrogen peroxide, and then peracetic acid and water. And eventually it all breaks down to water, which is why it's advantageous and used as an antimicrobial agent in food processing, because by the time you're cooking your chicken in your kitchen, there's no presence of the chemicals on your chicken anymore. So because it is a highly reactive chemical that is trying to break down into other things, it is also considered to be highly corrosive and an irritant to the skin and eyes. We see that irritation in the nose and throat with irritation to the lungs. And what we see a lot of times happening is a lot of coughing or shortness of breath. And then when there's actually higher exposures, you can ultimately result in pulmonary edema. Now, when we're looking at this, there was a study that was published by NIOSH in 2016, where they found that workers were experiencing these symptoms, even when the exposures were below the limit of detection when you're sampling using air sampling methods with a sampling pump and filters. And I'll get into that in a little minute, because that's one of the tricky parts of peracetic acid is the sampling for it. And I'll discuss that in just a minute. But the reason why it's challenging is because sampling for peracetic acid is highly selective because of the interaction with acetic acid and hydrogen peroxide. So if you're going to use normal industrial hygiene sampling to sample for peracetic acid, you have to have an air sampling pump, then you're connected to a sorbent tube, and then there's going to be a pre-filter that you're going to do sampling in line. So it'll go through the pre-filter first, which will sample for hydrogen peroxide, and then go into the second sample. It's further complicated because there's a lot of specifics related to this. It's sometimes referred to as the Heck method. It's sometimes referred to as the SKC method, but basically there's a lot of specifics related to how the media has to be kept cold, and then you have to do the sample, but you have to let the sampling media get to room temperature before you do the sampling, because when you go out into a hot, humid slaughterhouse or on an evisceration line, then you can have condensation in it if it's too cold still. And then after you're done, you have to wrap it up in foil so that it does not further react with the light, and then put it chilled and then ship it overnight. So there's a lot of complications when it comes to industrial hygiene sampling using a pump and sampling media. I did want to include like the overall health issues. The most benign is the tearing of the eyes or lacrimation, but it is pretty consistent in growing evidence of mild to severe discomfort, upper respiratory, and growing evidence of occupational asthma. Now, I know I've already spoken to some of these in my previous slide, but I did want to share that this is something that, as an industrial hygienist, I'm always encouraging my coworkers that I work with when I'm reviewing files that we're constantly doing lit searches, because there's new information being published all the time. And so when I did a quick little research before I did this presentation, I saw that there's 2 studies published in 2025, one showing that PAA induces cell damage and a pro-inflammatory response in human bronchial cells. and then a second study looking at the mice and them being exposed having this airwave hyperresponsiveness, which is comparable to, sorry, I didn't know that was going to pop up, comparable to occupational asthma. So one of the big challenges with peracetic acid is there's so much we don't know, and there's so much that we're learning in a day-to-day basis related to this type of exposure. So this is Bob. Bob is one of my colleagues that went out to the swine slaughterhouses. And here he is set up with all the air sampling equipment. And I just want to give you just a little bit of background on this. So when we were asked to do sampling for the swine, which is this portion that I participated in, is we wanted to mirror what they did for the poultry side. And that was already done by the time we came in. But what was decided that we were going to do for sampling is we were going to collect sampling for peracetic acid using the ChemDAC SafeSide 2.1 passive sampling monitor. And the reason why that monitor was selected is because you could purchase the sampling monitor and you could get real-time results, as opposed to doing classic industrial hygiene sampling, which I already explained how complicated it is. And if you've ever done air sampling in the field, you'd understand. But also over time, if you're collecting a lot of data, that air sampling samples using the HEC method or the SKC method cost about $200 a sample. And if you were to collect a lot of sampling like we did in this study, it would cost thousands and tens of thousands of dollars to collect the sampling. So we ultimately landed on having a ChemDAC SafeSide. And then also to include additional information and kind of give us a better idea on the humidity, the temperature, if there are other VOCs present, if there is particulate matter present. We used two sensors called an Atmo2 Pro and an AirNet, and those were looking at a variety of just general air quality metrics. And then we also carried a Bluetooth tablet that connects to the ChemDAC. And the beauty was we could also use that same tablet to connect to the Atmo tube and the AirNet. So the tablet became the device we used to collect all of the information. And so this same sampling protocol was mirrored in both the poultry side of the project and in the swine side of the project. Full disclosure, you will see that we do have a hairnet over the ChemDAC SafeSide. The version of the ChemDAC that we were using for this study, it is ideal if you don't get droplets of water and on the passive sensor. And so we wanted to make sure that we protected the sensor from getting large droplets of water on it. I don't know how many of you have walked around slaughterhouses, but there's a lot of dripping water, dripping blood sometimes, dripping all different things. And so that is something that we consistently did through all of the different sampling exercises. On the left-hand side of the screen, you see that there are a variety of different exposure limits, and this is another limiting factor when we look at peracetic acid. Peracetic acid does not have an OSHA permissible exposure limit, so that from a regulatory standpoint, we have to look to other occupational exposure limits. ACGIH has a threshold limit value set to a STEL of 0.4 parts per million. So that is the only occupational exposure limit that is published that we could reference. Now, in 2015, NIOSH published a draft IDLH value, which was 0.55. That has not had any more movement towards being published, but I just wanted to give you that as a reference point. And then there are acute exposure guideline levels, which are published by the EPA, and they go for a different framework, really looking at one-time environmental exposures, and they range from 0.17 to 0.51. I just want you to keep those numbers in mind, but for the sake of this study, we only reference that 0.4, which is the published occupational exposure limit from ACGIH. Okay. And thank you, Matt, for putting that question in. I will get to that question towards the end, but I can see that, and I do have something to say about interferences. So we'll get to that in just a minute. Okay, so on the poultry side, for the methods and the sampling, they took the ChemDAC safe side. And one of the challenges with the poultry side of the study and the pork side of the study is the overall goal was to look at whether or not when poultry or swine slaughterhouses sped up the speed of production, which would either be birds per minute or hogs per hour, heads per hour, whether or not that impacted adversely the workers. So from an ergonomic standpoint, you're looking to see if somebody's going to be working faster. From a chemical standpoint, we're really trying to see, is there more chemical being applied? Is there reasons that the chemical may be staying in the area because there's not enough air movement, because of the way the animals are moving through the line? And with the chicken side, they went to some plants that were running fast and some plants that were running slow. On the swine side, we were actually able to go to swine slaughterhouses where the first week they ran slow, and then the second week they ran fast, or vice versa. So we were doing a complete fast-slow comparison of the same exact location in terms of ventilation and every other factor. So unfortunately, the poultry was looking at different types of plants. So it's not an exact comparison. So the specific locations and PA application points that were selected were based off of a range of PAA exposures. And for the poultry side, they went and collected samples ranging from 1 minute to 15-minute time-weighted averages, really reaching for that STEL. And they collected a total of 2,680 minutes worth of sampling. And then they repeated these averaged over at the same sites multiple different times. And then they were looking at they're looking at whether or not in the different locations and different job descriptions compared at the plants that were running faster versus the plants that were running slower. And just like all of them, we collected that additional data. And then for the swine, since we had the beauty of doing a fast week and a slow week at the same plant, what would happen on our side is we would go that first week, and one of us, whoever was there the first week of sampling, would select the locations to collect the samples. And then those sample site locations would be locked in. And then we would collect 10 5-minute samples at each location during the slow run and then also during the fast run. And then we would compare them. So fast versus slow. I will say, just as a basis between swine and poultry, poultry uses copious amounts of peracetic acid compared to swine. While I did not visit any of the plants for this study related to poultry, I've been to a lot of poultry plants. And it was really eye-opening for me to see how many fewer intervention points there are in swine slaughter than there are in poultry as a general rule. So just kind of want to give you that background as well, that when we're looking at poultry, we're looking at a lot more application points. So what poultry's goal was to do a proxy where the industrial hygienist was sampling as close to as possible where the employees were sampling to get a representation of what the employees in that area were exposed to. Whereas on the swine side of things, we were not always near where workers were standing. So when we could stand near workers, we would. Otherwise, we collected between 5, 6, 7, 8 different sampling sites in the region surrounding those application points. And with the methods, our primary sampling method was using the ChemDAC safe side. And I see the questions coming in, and I am going to get to all of them when we get towards the end. So the study design for the swine side of things, and I'm going to go through the swine results first, and then I'm going to jump into the poultry results, is we were looking at doing a time-limited trial. That's what the letters TLT stands for. And HPH means hogs per hour or heads per hour that would be processed. And just to give you an idea, chicken plants process like 100,000 chickens a day, roughly. Hog plants or swine plants process about 10,000 hogs a day, roughly. That is not a rule across all of them, but that's around-ish what we would see. And for the swine side, we went to 6 different establishments. However, we only collected samples that we used in our analysis at 5 sampling sites because one of the sites did not use peracetic acid. We sent an industrial hygienist out to monitor, to confirm that PAA wasn't used. But then once we confirmed that, we did not continue sampling for the rest of the time. And to give you an idea of how much data we collected on the swine side, we had 22 different sampling locations at the sampling sites where there were less than 1,300 hogs per hour. And then we had 13 sampling sites at the sampling locations where they were. So we grouped the sampling sites as those that never really got that fast, and then those that got really fast during their time-limited trials. So that's a way that I would explain that. With the less than 1,300 hogs per hour, that was during the fast run. How fast were they going compared to the slow side? So we had a total of 35 sampling locations. We collected about 3,400 minutes of sampling, and 685 5-minute time-weighted averages over the course of that time. And that breaks down to 325 and 360 5-minute samples for the slow and fast times. So what did we find with swine? Well, at first, when we looked at the data, we were using non-parametric statistics because air sampling with peracetic acid is not normally distributed, even remotely normally distributed. And one of the reasons is the sampling challenges that we have with peracetic acid is that you have a lot of results that are in that 0 range. And sometimes even, well, as a rule of thumb, when using the ChemDAC, what I really recommend doing is turning it on and not turning it off, and keeping it paired and having it running so that it's able to continually be calibrating itself, not in a technical industrial hygiene calibrating way, but in a way that it's continually running. What you want, and I saw some questions about because you can't officially calibrate it, the calibration method for the ChemDAC is that you send the sensor back every 4 months and they send you a new one that is calibrated. But the way that we field calibrate it is we had it running in the plant in the office where we are setting up constantly for that 2-week period. And we made sure that we are in the room, it was always 0. We wanted it to be reading 0 so we knew the comparison when we went out into the shop floor, not the shop floor, the production floor. So that is one element. We did sometimes have it read negative values. One of the challenges also with sampling using sensors, and this is pretty much all sensors I have found, is that they are sensitive to some degree to large fluctuations in humidity and temperature. So what we did was we made sure that we always spent time letting the sensor get acclimated to the environment before we started collecting the samples as well. And that helped with that. So when we first looked at all of the locations, so we pulled everything together and we looked at all of the samples and we compared when the production line is running faster, when more hogs are being slaughtered, are you getting higher levels of PAA? And compared to the slower side. And what we found is, using the non-parametric statistics, yes, we had a p-value that was statistically significant. And that was with 325 matched pairs. So we were comparing apples to apples every time. That said, the exposure levels in these slaughterhouses were very low compared to what I've seen in other locations. We only had 4 samples, 0.6% of the samples that were above the ACGIH DEL. And so that's a huge factor to take into consideration. When we broke it down by the plants that ran the fast versus slow, but the faster side never really got much faster than the original level, we still saw that statistically significant. For the ones where we saw a wide range between the fast run versus the slow run, that statistical significance disappeared. So we wanted to dig in a little bit more and see what was happening. And we ended up finding out that the significance was really being driven by one particular site. So at one of the establishments, there was a large difference between the fast run and the slow run. And that was really driving all of the times that we were getting a statistically significant result. Now, I have some things to say about that, but I do want to share one case study. My biggest recommendation when it comes to peracetic acid is to remember that it is fickle. It is fickle and it wants to be something else all the time. And what you need to do is recognize that the closer you are to the peracetic acid, the higher the level of the application point, the higher levels that you're going to be exposed to, and that small adjustments can make a big difference. One of the sites, which is one of the ones that I happen to go to between the first week and the second week, on the first week, my colleague Sean was telling the employers that work at this slaughterhouse, hey, I noticed a lot of PAA by the direction of the nozzles and the way they were spraying was spraying outside the cabinet and not staying inside of these cabinets. So in swine, they call them Chad cabinets. In poultry, they call them OLR cabinets. But in my mind, if you're trying to imagine it and you've never been there, it's like a car wash for an animal, a slaughtered animal. So basically, the pig or the chicken is going to go through this and they're going to be sprayed just like in a car wash, but it's not with an antimicrobial agent, and that is an application point. So in this particular case, Sean, during the first week said, hey, we noticed that there's a lot of PAA escaping in water droplets. It's, it costs money. What if you try to enclose that more and maybe make sure that you adjust the ventilation in the Chad cabinet, and maybe you could reduce the exposures. So the company was really proactive, which we weren't expecting them to. And when we went back, when I arrived the next week, I noticed that they had added like curtain plastic sheeting to kind of enclose more the cabinets, and that my readings were completely different than what Sean had gotten the week before. And luckily, from week to week, we took lots of video and pictures. So I knew exactly where to stand. I knew exactly what it should look like. This does not look the way it should look. And so I sat down with the safety manager that I was assigned to, and I said, hey, did you guys make any adjustments? And then they told us all the things that they had done. And wouldn't you know, I said, cool. Well, we can't use this for the study because it's going to mess up our scientific studies. You have one variable, right? That's the line speed. We don't add all these other changes. So how about we do this? I said, I'll collect samples and we'll do a pre and post comparison to see if that made a difference. And then you guys go back to the way it was before and let me collect the data for the actual study. And so they did that. And what they found was by enclosing the cabinet a little bit more, so there wasn't any water escaping this cabinet, and then also by increasing the ventilation, meaning that the ventilation, suction ventilation that is inside the Chad cabinet to pull any vapors up and out, they increased that. We were able to reduce without controls. For both locations, it averaged 0.02 parts per million and then was reduced to 0.005. So it was a 77% reduction in the amount of PAA. That is the beauty of using a sensor, because if you're using a sensor in the same location and you collect repeated samples, then you make an adjustment and then you collect additional repeated samples, you are comparing apples to apples and you can see whether that adjustment made a difference and you can see it in real time. So I do want to say that that is one benefit to using sensor technology. And what we found for the PA related to swine was that we saw that there technically was higher PAA during the time-limited trial weeks compared to the non-time-limited trial. However, we think that was being driven specifically by one site. For the most part, however, because there were so many limited intervention points of PAA, PAA was overall very well controlled with respect to comparison to the ACGH STEL. Now, that said, in locations where we were seeing levels above the STEL, what we noticed was there wasn't a lot of air movement, or there was pooling water where drains were clogged. Maybe the drains that were underneath the conveyor belts weren't pulling it away or draining properly. And that was leading to those higher levels. And the spray cabinets were typically pretty well, if they had effective ventilation and had good drainage, they were great at keeping the PAA enclosed in that space. Now, on the poultry side, what we saw was there was not much of a difference between the fast plants and the slow plants. In fact, we saw higher levels as a general rule at the slower plants, but there's some factors that we need to really take a hard look at and understand. So 13 of the 61 establishments specific job categories, so 21% exceeded the ACGIH guide. So that's compared to 0.6 in swine to 21% in poultry. So we're seeing a lot more exposures that are exceeding that 0.4 parts per million. And in general, what we saw was the plants that were going less than 175 birds per minute compared to more than 175 birds per minute had overall what seemed to be higher levels. That said, one of the biggest contributing factors is the ones that were running slower, that didn't have that time-limited trial exemption, they tended to be older. And they tended to have not as great or updated ventilation systems, and they tended to have poor drainage. So those factors, and they tended to be more crowded. So there's not effective air movement because the birds are blocking the ventilation as they go around the conveyor belts. So it's really we're not sure that the speed of the production line impacted the chemical exposure, but the effectiveness of the plant itself overall, there's a lot more factors that play into that. There are two case studies that I want to share. One of them with the PAA dip tank proximity. And I just want to say that Dr. Noth found this, Betsy found this when she did her study, and I've seen this when I've done air sampling at plants as well. So I can second her observations with her data, with things that we've seen with our data that I've collected in the past in other studies, is that The closer you are to the dip tank or to the intervention application point of PAA, the higher the level of exposure. And that if you create more distance, you're going to reduce the exposure. This is really important because if you want to have a situation where you have some employees, they are being exposed to levels above the STEL, or you have employees that are experiencing adverse occupational symptoms, and you could look at moving them further away from the application point to help with reduction while you look at a more long-term in control improvement related to like increasing the ventilation, improving drainage, those factors. The second case study was they found that, and this is really where I get back to with when it comes to the PAA, it is really the ventilation that matters the most, not the speed of the lines. Though it does play a factor, it is a confounding factor, but the ventilation is a huge player. They were doing sampling at the chiller rehang, which is, so basically after chickens go through an evisceration line, they fall into this chiller and then they kind of swirl around in it for a little bit. And then they come out of the chiller. And when they get dumped out of the chiller onto this tray, there's employees that are picking the chickens up and then rehanging them onto shackles to go along for further processing. And this process, they're coming out totally covered in water that contains peracetic acid. So this is where we normally see some of the highest levels of exposure. And in this particular instance, they saw a statistically significant difference between whether the fans were on or the fans were off. And so just the basic addition of adding fans and adding movement of air completely reduced the exposures. Well, not completely, but significantly reduce the exposures. So I'm always looking as an industrial hygienist, what are the quickest questions that I can tell a frontline manager to ask so that they can triage the problem right away if they have complaints. So questions to ask, are the fans turned on? If no, why are they turned off? I will tell you why employees turn it off is if it's cold. So like in the winter when it's really cold, they turn the fans off because they don't want to be even colder. So how can you assist them in those areas? Has the positioning of the fans changed? So sometimes an employee doesn't want to feel the fans on their face, or maybe there is an employee that wanted the fans on them, so they adjusted the direction of fans. I saw this happen at one of the facilities I went to on the swine side. So you want to know, have the positioning of the fans changed? Is there enough air movement? And if no, what's blocking the air movement? Is it pallets? Is it boxes full of chicken? Is it because there's so much product running around that the literal chickens hanging from the shackles going around are blocking the airflow, and employees aren't getting enough movement of the air? So those are some questions that you'd want to be asking. So the conclusion on the poultry side was that the evisceration line speed was not associated with airborne PAA concentrations. However, there were an excessive amount of employees that were exposed to airborne concentrations above the ACGIH STEL. And that's important because the STEL is only supposed to be for 15 minutes, but these employees were working there sometimes 8, 9, 10 hours. So very important to kind of highlight that characteristic. All right, so I quickly went through that. I'm going to leave my QR business card up, but I wanted to leave ample time for questions and give you a time to kind of figure out what's going on. So I am going to see here. I'm going to start with Stephen. So he said, I haven't seen that the ChemDAC PAA method has been independently validated or published in a peer-reviewed journal. If so, how can one be assured that the concentrations are valid? Great question, Stephen. What I will say is that I had previously, in a study I did for U.S. Poultry and Egg Association, years ago, did a study where we did sampling. And this was what was really ridiculous because we held 3 different sensors all at the same time and had an air sampling pump using the Heck method. So we looked ridiculous with 3 different sensors and the Heck method. And we collected repeated measures with the 3 different sensors and the Heck method. And you can reach out to the U.S. Poultry and Egg Association to get access to that study because they own the study, and chose what to do with the results of that study. But we saw that there was a close correlation between the Heck method and the Chemdex sensor. Unfortunately, we were not permitted to publish them in a peer-reviewed journal, but that is really needed. I will say that would help alleviate a lot of concern that industrial hygienists have, that we can say, okay, good, this is in the literature, and we can say that this is consistent.
Oh,
Yes, go
sorry, I
ahead.
didn't mean to interrupt you. Thank you
No,
so
you're
much
good.
for your answer. I was just going to also let the audience know we do have plenty of time for questions. So if you have other questions that you want addressed, please do feel free to go ahead and put them in the Q&A for us.
So yes, and I will say that I kind of felt like there might be a lot of questions, which is I didn't rush through but I always like to leave a lot of time open for questions and answer.
Yeah.
Um,
Another question that's come in, someone says they apologize if they've missed it, but they're wondering if you could comment on the environmental stability of PAA. Does the mist or vapor degrade rapidly, and is the rate affected by humidity or temperature?
yes, so I will tell you that one of the things I am really sad about with NIOSH is I know that NIOSH was actively conducting studies looking at that exact factor. And they had started the research prior to COVID. And then all the scientists that were on that COVID, all the scientists that were doing this PAA research kind of got pulled off in other directions. And then they were going back to it, but they hadn't gotten to the point where they were publishing that information. And so just another reason why NIOSH is so amazing. And I did not intend to kind of go into this diatribe about why NIOSH is so important, but I had been waiting patiently, like twiddling my thumbs for the NIOSH studies on PAA to be published so that I would have this independent, well-respected organization telling us about it. I will tell you, as a ad hoc experience, what I find is that it behaves a lot like any chemical. The hotter it is, the more humidity, the faster it's breaking down. And so we've noticed that with our air sampling results when we've gone out to other poultry processing plants. I've seen that that in the higher temperature areas that we see the higher exposure. So PAA is very reactive with higher temperatures. The other element to your question about it being a mist or a vapor and how quickly it degrades, that is one question that I have for real. And I've asked, and I was hoping that when I had talked in the past with the researchers at NIOSH that were working on this, one thing that I've noticed out in both swine plants and in poultry processing plants is that the way the PAA is applied is all over the map. So sometimes it is applied in what I call the car wash method. So it's either an OLR cabinet or the CHAD cabinet. And those are sort of enclosed systems where the chicken or the pigs are going through it and they are being sprayed. However, it's all over the map how many spray jets are spraying the chickens and the pigs. And also, over time, you can have the buildup of fats and other elements that can clog the spray nozzles, so that sometimes it is like a water jet, and sometimes it's like a fine mist, and sometimes it's conical in shape. And the different ways that it sprays really will and I have lots of questions about how much of it is in the air in a fine mist versus it being a vapor. So really great question to ask, because I also asked that question. Then another way that it is applied is in a chiller, and that's primarily in chicken processing. And that is a huge vat with a spinner in the middle that is slowly churning the chicken and bathing them in this water bath that has cold water bath that has PAA in it. That comes out, and that is mostly vapor when it comes out, because the chickens are coated in the water, but it's not being sprayed. And so you will have it going into the air as a vapor as opposed to a mist or a droplet. Then further on in chicken processing, and sometimes further on in swine, they will have under the conveyor belts, there will be a bar, and then there will be these spray nozzles, and the spray nozzles will spray down onto the conveyor belt to spray the chicken or the ribs or whatever the piece of meat that you're processing. And again, just like in the cabinets, those spray nozzles sometimes can become clogged or adjusted. And they can have varying degrees of what they're spraying and how fine of a mist they're spraying. So we have that, is it a mist? Is it a vapor? Is it a droplet question in our head? And if you want to be a nerdy IH, you can message me and I'll have like this long 2-hour conversation where we'll have an esoteric question of what state is it in at which part of the plant, because that's something we definitely. And then the final way we've seen it applied is then along the conveyor belt, sometimes they'll do a dip where they'll be like, it's kind of like going on a lazy river for the chickens, where they go along the lazy river and then they suddenly sink into this water and then they come right out of it. And that again is more of a vapor that you're breathing in and not a mist or a droplet. So I hope I explained it. I didn't really answer your question, but I also agree that that is a good question to have.
Yeah. Well, and I think there's some kind of tangential questions to understanding that process. One is, are there different concentrations of the solution? And then also, what is the ambient processing, or what is the ambient temperature in the processing line?
Great question. So the first part is there are varying concentrations. And you will see the concentrations vary dependent on the time of day, actually. And this, we have not fully broken it down in the analysis. That was part of our, future questions that we might do in future studies when we pull out. But we did collect, so QA people at food processing plants collect titrations of the water. So it comes in a concentrated form, and then it is diluted into different concentrations throughout the plant, depending on the application type. And there's limits to how high the concentration goes, but in general, they're not going up to that high level metric. They're much lower. And so we're seeing it between like 200 to 600 parts per million in the water, but it can get up to much higher than that. Don't quote me on those numbers because I don't remember them totally off the top of my head. However, what I will tell you is, and this is where communication is so important in plants, that the people who are doing QA, if they're going to push more chemical out because they had a chicken test positive for salmonella, or something happen and they're going to push more out, they should be talking to the health and safety people to let them know. Because I have been out in plants not related to this study where that has happened, and you immediately can tell because you can smell the change. So that is the case with that.
Thank you so much. I actually have a follow-up on that. Is that a common practice, like the QA people talking with the health and safety people? Or what did you observe in terms of the communication between those different groups, kind of live on site?
Yeah, so that it's all over the place. It's just like any other safety and health management system. Some companies have really great communication. Some people, that's an area of growth for them. So that is something that we've gone out and assisted companies in the past, kind of communicating to them and running workshops with them on what information needs to be actively communicated with each other to really improve their safety and health management system and also improve food safety. I mean, it's two sides of the same coin for public health. One side is the worker health and one side is the customer health. So we want both to be successful. We just want to make sure that there's good communication.
Thank you. Another question, are interferences an issue? Poultry plants, I've evaluated the issue with chloramines from the superchlorinated water and nitrogenous waste.
Yes, absolutely. Interferences are a huge factor. And again, that is where we were waiting for NIOSH to publish their study. Because one of the things that they were researching was they were doing tests with the various sensors that are available on the market to compare the interference chemicals to see whether or not, like, is the sensor you're using reading that chemical, or is there another chemical present that it's reading? So that's the first question. And then the second question is, and I'll give you an example that I've experienced, and this is not related to this study. I just want to point that out. So there's no questions because it's not in the report. We went to one company where they were having the USDA inspectors were complaining about odor and smell and lightheadedness and trouble breathing. And what we were able to determine after doing a walk through the plant and collecting samples is that they had the PAA application point along the conveyor belt line, but then kind of at a 90-degree angle next to that was a parts wash. And so for those of you that are not familiar with food processing, a parts wash is basically where if a chicken part or an animal part is seen that has any sort of gunk on it, for lack of a better term, it'll be pulled off and it'll be washed. And that is usually done with a chlorine. And so what we were seeing was an interaction between the peracetic acid and the chlorine there that was happening. What I would love to see are a published study, which again was something NIOSH was working on, of this sensor has, just like when you do Draeger tubes and you pull out the little paper that comes with the Draeger tube and it says, it'll change color for this chemical, but the interference chemicals are this, this, and this. It would be lovely to have that information as well.
Thank you
Just
so
ad
much.
hoc, I do see that interference happening.
Yeah. Yeah, another good reason, if you haven't yet, make sure this to the audience, feel free to reach out to your representatives about the important work that NIOSH is doing or was doing, and we hope can continue.
Yeah, I didn't expect to get into such a like, oh, hum, ho, hum. I wish we could see this, but they're great questions that led into that
Yeah,
organically. Yeah.
absolutely. Have you done any measurements of acetic acid? Is there any correlation of levels of PAA and AA?
So for this study, we only were funded to look at peracetic acid. So unfortunately, we only collected sampling with the peracetic acid. That said, there is always an association with PAA and acetic acid because peracetic acid cannot exist without acetic acid. So the mixtures that the corporations, the plants buy is a mixture that it always includes a percentage of acetic acid, hydrogen peroxide, peracetic acid, and a stabilizer. So every safety data sheet has 4 chemicals or more listed in the product. So, and what you smell a lot of times is the acetic acid because it's that strong vinegar type smell. But we unfortunately didn't record what the acetic acid was for this study.
Well, thank you again so much for your research, for sharing your research with our audience today. Do you have any closing thoughts before we wrap up today's session?
I just want to say thank you for giving me the time. I knew I would spend that much time on Q&A. I always end up needing lots of time for Q&A. I am happy to set up a call with anyone who wants to discuss this in greater detail. I'd also be happy to connect you with the researchers that did the poultry side. Thank you very much.
Well, thank you again so much for your work in keeping workers safe and sharing with us today. Thank you to all of you who joined us online as well for today's webinar. You can be sure to check out our website for more information and to register for other upcoming talks. And again, we just invite you to check out the links in the chat to also learn what you can do to express support for NIOSH. Thank you all so much for being here, for the wonderful questions and participation, and I hope you all have a wonderful rest of your day.
Thank you.